Okay. If you are a parent, if you are a mother or a father, and if you have questions about education, special education, mental health, you need to text my phone at this time, 215-989-9858. If we do not get any parents, we will be closing out early today. If we do not get any parents, we will be closing out early today. Now, of course, it is ridiculous to not have any parents with concerns when you look at what is happening to our children in these schools. So I guess a lot of you Negroes are sleeping when you should be up, learning how to save your children. I know some of you got to go to work, but I will not be doing these teleconferences often because I'm too busy with Frederick Douglass Marcus Garvey Academy renovations. So if you have a question, text your first name and your city. If you have a question, text your first name and your city to 215-989-9858. I repeat, TikTok family, if we got any parents on TikTok with questions, 215-989-9858. Do not call the phone. Text your name and city. Do not call the phone. Text your name and city to 215-989-9858. 215-989-9858.
Yes, hello, good morning, Dr. Johnson.
Good morning, Brother Kelly, from Virginia, I think you are?
Yes, correct. I'm sorry, I was supposed to put the city. The city is Woodbridge, Virginia, correct?
Woodbridge, Virginia, no problem. I never spoke to Woodbridge, but I've driven past Woodbridge many a times, good brother. Go right ahead with your question.
Yes, good morning. Thank you for taking my call. Not a big question. I'm a fairly new parent with a 9-year-old and a 4-year-old, both on the spectrum. I'm military, so I've been living and kind of just moving around with my child in the military with autism and my wife. And my question is, probably, I don't know if you can help me out, but once I transition out of the military, I'm just trying to make sure I get the best help or the best coaching for my two sons. Again, both 9 and 4, both on the spectrum. So yeah, just want to get your advice and just what your experience is with, with kids on the spectrum, sir.
Indeed. I have a lot of experience with children on the spectrum. I've done a lot of autistic evaluations in my career as a certified school psychologist. In fact, some of the most intelligent children I've ever evaluated, meaning they had the highest IQ scores, they were almost always the autistic children. A couple things, and I'm going to speak about the 4-year-old somewhat separately from the 9-year-old, because with your 9-year-old, he's old enough for us to be confident in his diagnosis of autism. With your 4-year-old, we may still be fairly confident, but you want to be certain, because 4 years old is pretty young to confirm autism for sure. Now, do doctors do it? Yes. Do psychologists do it? Yes. Do psychiatrists do it? Yes. But I am not a big fan of making a strong autism diagnosis at 4 years old, because there are other conditions that can mimic autism that are not autism. So, for example, I've seen children 4 years old who have speech and language problems mistaken for autism, who have a hearing impairment mistaken for autism, who have a developmental delay mistaken for autism, social anxiety mistaken for autism, emotional trauma mistaken for autism. Antisocial personality disorder, mistaken for autism. So be slow to be certain about the 4-year-old. And the reason for that is if you put your 4-year-old in an autistic support class with other children who are autistic, your child will begin to mimic the behaviors of the children he's around. And so a child who is not autistic can begin to develop autistic features because they are imitating the other children. Now, the school system and the preschool system and the early intervention system is going to want you to rush to judgment. And the reason they're going to want you to rush to judgment is they want to start getting paid. There's a lot of money in special ed. There's a lot of money in disabilities. And so the schools love for parents to rush to judgment so they can put your child in that system and start making money off your child. So you have to tell them, or, slow them down and say, hey, I do see some features of autism in my son. I'm not in denial. I do see features, but I am not yet certain this is a full-blown case of autism. So we're going to be patient. We're not going to put him in the autistic support class this early. We still want him in a regular class because he might just be a late bloomer. He might just have a speech problem. We're going to give him the speech and language therapy. We're going to give him social skills training, but we're not going to put him in an autistic track just yet because we want to be sure. Autism doesn't have a cure, so there's no need to rush the diagnosis because you can't get rid of autism. It's not like cancer or diabetes. You catch it early, you can reverse it. Autism is autism. There is no known cure as of yet. So whether you put him in special programming at 4, or whether you put him in special programming at 6, or whether you put him in special programming at 8, it's all going to be the same. So you don't want to rush. In addition to that, and this is for both boys, because autism is a spectrum, children with autism can go from high-functioning autism to low-functioning autism to mentally gifted and autistic to intellectually disabled and autistic. It's a spectrum. Your two sons, even if they're both autistic, can be on two different places in that spectrum. So because of that, if you do decide to put your son in an autistic support program and your 9-year-old may already be in an autistic support program, meaning he has an IEP, meaning he receives special ed service, you have to make sure the classroom that he is in, the autistic support placement that your son is in, you want to make sure it is appropriate for his developmental level. In other words, if you put a low-functioning autistic kid in a high-functioning autistic class, they may not make it. If you put a high-functioning autistic kid in a low-functioning autistic class, they're wasting their time. Because it is a spectrum, autism is the one disability where you just can't lump them all together. See, if all the kids are emotionally disturbed, you could put them all in the emotional support class. If all the kids have a reading disability, you could put them all in the learning support class. If all the kids are blind, you could put them all in the school for the blind. But if they're all autistic, you can't put them all in the same class. Why? Because autistic kids have a greater degree of variability amongst them. It is a spectrum. And because it is a spectrum, two kids with autism can present in two totally different ways. So you want to make sure your son is in the right placement. 2 other points, and then I'll be quiet to see if you have a follow-up question. 1 point is this: do not put your sons on medication. They often push medication for autistic kids for behavioral problems. I would never put any of my kids on autism, but especially not, on medication, but especially not my autistic children, because that medication can further impair their disability, because autism is neurological, and these drugs that they give our children for hyperactivity, so forth and so on, mood disorders, they give a lot of mood stabilizing drugs to the autistic kids. That's only going to further exacerbate the challenges that they already have. So I would not put them on meds. Autism doesn't have a cure.